Hello everyone, this is Riley Scroggins, and today I'm going to be talking to you about my healthcare resolution paper, which focuses on the anti-vaccination movement in the United States. This presentation will highlight the following topics. First, we'll look at the target audience of the anti-vaccination healthcare policy resolution. Then we'll discuss the prevalence of and negative consequences of the anti-vaccination movement. And finally, we will look at a resolution plan for the anti-vaccination movement. So first of all, the target audience for this healthcare policy resolution is healthcare professionals. Advanced practice nurses have the responsibility to both educate patients and lobby for policy change regarding non-medical exemptions to pediatric vaccinations. Healthcare providers who are committed to increasing pediatric vaccination adherence are needed to implement policy change and educate patients. So the root of the issue of the anti-vaccination movement is that 18 states allow for non-medical exemptions to pediatric vaccinations. As a result, in 2015, only 72.7% of children aged 19 to 35 months were fully vaccinated to the standards of the Advisory Committee on Immunization Practices. This has some negative consequences. Children lacking immunizations have a significantly increased risk for contracting vaccine-preventable diseases such as measles and pertussis. A child not vaccinated with the MMR vaccine is 35 times more likely to contract measles. In August of 2019, there were 290 confirmed cases of measles in Rockland County, New York. 78.3% of these cases had not received the vaccine. Many parents choose not to vaccinate their children because they're scared of the reactions or side effects that a vaccine may cause to their child. However, did you know that you have a 1 in 12,000 chance of getting hit by lightning, but only a 1 in 1 million chance of having a reaction to a vaccine? One potential resolution to the issue is to require parents who are requesting a non-medical exemption to undergo additional education regarding childhood vaccination. The education will be conducted through a class presented by a healthcare professional. Some resources needed to implement the plan would include classroom space and healthcare professionals who are willing to teach the class, as well as educational materials on pediatric vaccinations. You may be wondering how this resolution plan will work. Why will increased education help diminish the prevalence of non-medical exemptions? Well, the most prevalent reasons parents choose not to vaccinate are religious reasons, beliefs that vaccines cause negative side effects due to dangerous ingredients, too many required doses, and beliefs that vaccines are unnecessary. These reasons lead to the conclusions that parents need to be educated on both the safety of vaccines and on the necessity of vaccines. A systematic review found in the Official Journal of the American Academy of Pediatrics reviewed the safety of childhood vaccinations and found strong evidence to prove that the MMR vaccine is not associated with increased risk of autism. In addition, other vaccines are not found to be associated with childhood leukemia. The myth that the MMR vaccine causes autism is one example of the lack of education parents have that we need to be addressing as healthcare providers. Although many believe that the MMR vaccine causes autism, there has been significant research to suggest that it does not increase the risk for autism, does not trigger autism, and is not associated with clustering of autism after vaccination. Here are my references I used for this presentation. Thank you so much for watching my presentation.